Hello, everyone. You are listening to the Area Agency on Aging 1B 101 webinar. I'm Andrea Mulheisen. I'm the Planning and Resource Development Manager with AAA 1B.
And I'm Ryan Calmetto. I'm the Clinical Manager over our ASA programs and the Resource Center here at the AAA 1B.
So we're just going to take a little bit of time and kind of go through some of the basics about what are AAAs, what do we do, how can we help you or your clients, more importantly, or the people that you serve, and then talk a little bit about some of the specifics with our current programs and how to access them. So what is an area agency on aging? We get that question fairly frequently. All of the AAAs were established in 1974 at the federal government level. And we're really part of a national network that works together to make sure that older adults and caregivers and advocates have access to local and state resources, and really just looking at improving the quality of life and the quality of care provided to that population. So no matter where someone lives, there is an area agency on aging designated to serve them. If they call us and they're calling for their mom or dad or whoever it may be that lives in a different state, will get them to that area agency on aging that's designated to serve them. Most of the programs we provide or fund are for people over 60. There are, of course, some exceptions depending on if you're a caregiver, or some programs do target 50 or 55 plus, but generally we're talking about programs for those over the age of 60. And we are an unbiased source of information, and that is one of the things that makes us unique as compared to some other service agencies. At times when you call us, we'll give you a list, we'll give you some options, but we really try to be as unbiased as possible when we provide people with resources. So I mentioned the National Aging Network, and this is just a depiction of that network with older adults and caregivers, of course, at the top. We have local service providers, which is really how most of the services we receive funding are provided at the local level. We fund a lot of those agencies. Some of you may work for those agencies either through our contract and RFP process or through our what we call our DSP or vendor model, which we'll talk about in a few minutes. There are over 600 area agencies on aging throughout the country. So again, some states might have several. Michigan has 16. Some states may have one area agency on aging to service the whole state, and that's really determined by the state in terms of how they set that up. Specifically determined by the state unit on aging. And our state unit on aging in Michigan is the Aging and Adult Services Agency, which was formerly known as the Office of Services to the Aging, or OSA. And then at the federal level, we have the Administration for Community Living and the Administration on Aging, which kind of connects everyone together. So funding, we have a few different sources of funding. The majority of our funding comes from the Federal Older Americans Act and the Michigan Department of Health and Human Services through the Older Michiganians Act funding, as well as Medicaid waiver dollars, or PAHP program, which we'll explain in a moment as well. We do get some local county match dollars, as well as some private foundations and grants and some public donations, but again, most of the funding is federal and state level funding. We're really looking at changing that a little bit and trying to diversify our funding streams, because we know that that funding is not going to be able to meet the need and the demand for services, but at the moment that is our main source of funding. And the majority of funding we receive does go out to services and to local services. We only use about 3% of our total funding for administration. Here's a map of the 16 area agencies on aging in Michigan. Our region 1B is in the kind of light green area, and you can see some of the area agencies cover a wide geographic area, and some are a much smaller area. There are actually 2 in Wayne County, but obviously the population density is higher there than in some of the more northern parts of the state. So again, in Southeast Michigan, there are 3 area agencies on aging. We service Livingston, Macomb, Monroe, Oakland, St. Clair, and Washtenaw counties. There is also the Detroit Area Agency on Aging, or DAAA, or 1A. Kind of, we all have a little bit different names we go by, as well as the Senior Alliance, or AAA 1C, which kind of serves the more suburban Lane County area. So AAA1B, just a little more about us if you're not familiar. We are the largest area agency on aging in the state in terms of population. We have over 620,000 older adults in our region. So we may not have the largest geographic area. There's certainly AAAs in the more northern part of the state that do have more counties, but we have the largest older adult population. We are CARF accredited. We were the first AAA in the country actually to become CARF accredited a few years ago, but since then several more have also obtained that accreditation. We do administer the My Choice waiver or the PAHP, Prepaid Ambulatory Health Plan. It's gone through some name changes as well. Not all AAAs administer this program, but the majority of them do in Michigan. We are based in Southfield. Our main office is in Southfield, but we also have offices in Ann Arbor, Monroe, and Macomb counties. We have a little over 150 employees. Of course, that fluctuates a little bit as programs change or come and go, but on average, around 150 employees. And our mission is to enhance the lives of older adults and adults with disabilities in the communities we serve. So another question we frequently get is, what do you do, and why are, if I call one area agency on aging, I might get different information or access to services than another one? Well, that's because while we are all set up to do 4 core things, we all may do them a little bit differently. So we're responsible for planning and coordination of funding and programs in our region, as well as allocating that funding to make sure the needs are met through services in the region. And we do a lot of advocacy, and a lot of you know us for that, for our advocacy efforts and campaigns. So every area agency on aging does that to some capacity, but some of them are very small and some of them are very large, so we just have to go about it in different ways. And we're responsible for ensuring that each AAA meets the needs of the region. So depending on what other funding sources or programs are available in that region, a AAA may choose to fund or not fund a certain service or program. So I want to talk about the Older Americans Act funded programs. These are kind of the core programs of any AAA really. And it accounts for about $22 million annually. And again, that fluctuates a little bit every year depending on state and federal budgets. But the majority of that funding goes to the services listed here, as well as some I'm going to list on the next page. Most of the programs that we fund, again, we don't do directly. We fund local service providers to deliver things like home delivered meals and adult day programs. However, we do provide information and assistance, and that's our call center. So if you call our 800 number, you'll reach one of our resource specialists. Ryan's going to talk to us about that in a minute. We provide care management or case coordination services, which are mostly provided by licensed social workers or in some cases an RN. The community living program is a program I'm going to let Ryan talk about as well in a few minutes, and that is one that's fairly unique to our AAA. Other agencies may do it in a slightly different way and won't be necessarily calling it that. Nutrition programs are one of our bread and butter programs. Again, these are home delivered meals and congregate meals. We provide adult day health services in our region, and by we I mean our network. There are health and wellness programs available. These are things like PATH and Matter of Balance, healthy eating. And then we also provide outreach through what we call our resource advocacy program. And these are, again, mostly provided at the local level through a variety of different agencies that are really charged with reaching the most isolated, the most vulnerable older adults. So on your screen, I'm not going to go through each program, but on your screen is a list of some of the other programs that we choose to fund in our region. Some of these programs may not be available, for example, in Wayne County or in Jackson County through their AAA because they choose to fund things a little bit differently. Again, we look at what's the needs of our local community, what do the providers tell us is needed, and what do other funding opportunities are available to help fund services besides through our organization. So I'm going to turn it over to Ryan, who's going to talk to you about our INA program as well as some of our care management services.
Thank you, Andrea. I'm going to start by talking about our Information and Assistance Center, or our Resource Center, or the call center, as you may know it by. But essentially what you need to know is our phone number, 800-852-7795. If you're working with an individual who doesn't know what they need or kind of where to turn, we like to think of this as the first stop to get people assistance. The folks that answer the Resource Center phone calls are all AIRS accredited or AIRS certified resource specialists. And that stands for the Alliance of Information and Referral Specialists. It means that they have special training, they meet certain standards, and they actually take tests to be able to provide these services to individuals that call them. It's the primary method for accessing many of our services, so they provide intake functions for our community living program, our My Choice Waiver program, and several other programs. They have access to over 5,000 services provided by over 2,000 different organizations throughout our 6-county service region. And as I mentioned, they do provide basic screening for government-funded programs. And here on your screen, you see a list of the most requested services for the Resource Center. So obviously, housing is a major issue as people age, and particularly as they age in place. So lots of calls on where to turn, what to look for, what are the different types of housing. Case management services, home delivered meals, housekeeping services. Maybe someone needs help with legal issues or some probate issues or establishing some estate planning. So that would be a resource for legal services. We offer personal emergency response systems for individuals who are waiting for our community living program or for our My Choice Waiver program. We provide Medicare Part D counseling. All of our resource specialists are trained in what we call MAP, or Medicaid Medicare Assistance Program counseling, so they can help out with different issues that older adults may be having navigating that system. People call oftentimes for personal care, needing some help to stay in the home, or they're looking for in or out of home respite. Transportation is a big issue. Locations of senior centers or community activities for socialization, support groups, and also utility assistance help. Those are our most commonly requested services. I'm going to spend a little bit of time talking about some of our care coordination programs, and these are programs that the Resource Center staff can help provide an intake for individuals looking for these assistances. I'm going to talk about the Community Living Program, which is kind of a unique entity, although some other AAAs may have something similar. I'm going to talk about Community Care Management and also our My Choice Home and Community-Based Waiver Program, also known as our Prepaid Ambulatory Health Plan. So I'm going to start with our Community Living Program, and this is a unique program that bundles several different types of services that we provide into one package. And so it's federal Older Americans Act dollars and state funds, which are used to help keep people in their own homes as long as possible by providing them with some support. And that could be with maybe it's personal care, so the hygiene needs, or preparing foods, or it could be housekeeping needs. It may also be a need for transportation, and we can bundle all those services under the Community Living Program. So what we have is a team of social workers and nurses who actually do assessments on individuals who are waiting for the program, develop a consultation summary and a strategy plan that outlines what an individual's needs are, and then we may be able to help them purchase those services in the home so that they can stay there. We don't actually provide the services ourselves, but we use a vendor pool of home care companies and home health aides to provide those services in the home. It's a very busy program. We get about 170 referrals every month to this program. So at any given time, there is generally a wait list, and it can be several months long. Basic qualifications for the program. It's a federally funded program, and so anyone over age 60 is technically eligible. There are no income requirements. However, we are charged by targeting the most economically, functionally, and socially disadvantaged individuals in our region, so we do ask for income and asset information. It's available for caregivers of a person over age 60, so if you're an adult child and you need some help supporting your parent, they may be eligible for this program, or we could potentially serve you as the caregiver through this program. It's for individuals who require some assistance with daily needs, again, be that personal care or homemaking needs, and it's for individuals that live in Livingston, Macomb, Monroe, Oakland, St. Clair, or Washtenaw counties. Community care management is really a level of the community living program. It's for individuals who need a great deal more assistance than our typical person that we would help through the program. So they would be eligible for care management services if you have a high level of need for daily living supports, or if you essentially can pass a nursing facility level of care determination. So this would be someone that's technically eligible for assistance in a nursing home. We can provide a moderate to high level of help with daily living. Again, we use social workers and nurses to develop strategy plans to help assess what a person's needs are from a very person-centered planning model. And then we can also provide referrals to outside agencies, resources to help meet people's needs. For both community living program and community care management, we do request a cost share, and that's based on a person's income and ability to pay. Now I'm going to talk about the My Choice Medicaid Waiver Program, also known as the Prepaid Ambulatory Health Plan. This program is a little bit unique for us as a AAA because we can serve anyone over age 18 who has a recognized disability. To be eligible for this program, you do need to be medically eligible for nursing home care, which means you have to pass the nursing facility level of care determination, or the NFLOC. There are income guidelines, so you have to have a monthly income of $21.99 or less and assets less than $2,000. There are certain carve-outs for spouses and couples that are seeking this program. So if you have particular questions, I'd recommend talking to one of our resource specialists about that. But essentially, the My Choice Medicaid Waiver Program provides a wide range of in-home service options that really are designed to help a person remain independent and in the community that they call home. Most programs are at capacity across the state, and so there generally are a waiting list, and ours can range anywhere between 4 months and 8 months. We also provide community transition services, and these are for individuals who are currently residing in a nursing home but would prefer to be out in the community that they call home. This is a team of social workers and care managers, and they may also be nurses, who identify the different needs a person may have that would prevent them from being able to move back to the community. This team then works at breaking down those barriers so an eligible individual can go back out into their own home or community that they call home. You have to meet the My Choice program criteria that we talked about previously, and again, there can be a wait list for this program depending on the time of year and the need. This slide is a comparison between our community living program and My Choice. So on the left, you see CLP. We have no income requirements. It's age 60 and over only, unless you're a caregiver of someone age 60 plus. It uses federal and state funds. Services are limited. In fact, under the CLP program, we can only provide up to 10 hours per week of assistance. That's really the maximum that we can do. For community care management, individuals have to have a higher level of need, and this is actually conducted in-home versus a telephonic model, which most of our folks are served with. And cost share or donations are requested. My Choice, again, you have to meet the income and nursing home guidelines, age 18 plus. You must need comprehensive services, nursing services, counseling services, homemaking. It's done through an in-home assessment process by an RN and social worker team. We also have the Community Transition Program, which is a subset of My Choice for individuals that are institutionalized that want to move out. There are waiting lists. And under My Choice, as it's a Medicaid program, no donations are allowed. We have a couple of different additional care management programs I'm going to touch on briefly. Rapid Response Respite. This is available for caregivers that are under age 60 but caring for a loved one over age 60. And then we have Independent, which is a personal emergency response system, and that's available for anyone on our waiting list for the community living program or for the My Choice Waiver Program. This provides up to 1 year of a PERS at no cost to the individual. Now I'm going to turn it back over to Andrea, who's going to talk about our DSP, or our Direct Service Purchase Provider Pool.
All right, thank you, Ryan. So briefly want to mention, because a lot of the people that listen to this webinar are service providers or work for a service provider agency, I just want to explain the difference between what we call our DSP provider pool, which we also call vendors, versus our contracted agencies. So the DSP provider pool provides the services that Ryan, to the clients or participants that Ryan just talked about in our community living program or our My Choice Waiver program. So these are agencies like home care, our PERS providers, our adult foster care homes, transportation. These are agencies that we have vetted that have met specific insurance and policy requirements that we have and are in our pool to call upon to provide services to individual clients as needed. So some of these agencies may be serving 0 to 10 clients, and some may be serving hundreds of clients. It's just based on need and their ability to meet that need. We have over 100 providers in this pool, and it's typically something we open up every 3 years unless we really have a hole or a demand for a service we cannot meet. And that is a little bit different than our contracted agencies. Those are agencies that are provided kind of a lump sum over 3 years. It's also a very competitive process. We're actually getting ready now to open that process up. So depending on when you're listening to this, this is March of 2016, and soon we'll be releasing a request for proposals to participate in our contracted provider pool. And there's information on our website if that's something you want to check out. And so those contracted agencies are really providing the services in the community that I'm going to cover now. There are non-care management programs and provided at the local level. Most well known, again, is our nutrition programming, the Older Americans Act, that's the OAA program. It's a little over $10 million now, and we use about 12 local service providers to provide the home-delivered meals and the congregate meals in our 6-county region. There is an assessment that anyone participating in those programs in the home-delivered meal program needs to do, but it's something that all the local providers do directly. And it really heavily depends on volunteers for both the home delivered and congregate meals, but especially home delivered because of the thousands of meals that go out every day. The funding just isn't there to pay people to deliver all of those meals. So those programs heavily rely on volunteers to make sure those meals are delivered. The congregate meal program is held typically at a senior center or community center, perhaps a church or another place of worship, anywhere that's kind of central to the community that people may congregate and gather. And it is a meal. A donation is requested, but anyone is welcome to go and enjoy that meal at the full cost of the meal. I think it's usually $6 or $7, even if you aren't 60 years of age. So we encourage you to do that if you haven't had the opportunity to visit a congregate meal site. And both the congregate and the home delivered meals, we say, are more than just meals. You know, it's socialization at the congregate site. It's a check, a wellness check for the home delivered meals who sometimes those participants don't see anyone else but their meal driver on that day. Just a little bit more about some of our contracted services and specifically our respite programs. We do work with over 9 different adult day house programs throughout the region. Great opportunity for caregivers of persons with dementia, not taken advantage of as much as they should be, frankly. A lot of people are uncertain or fearful of sending their loved one to an adult day program, but almost everyone that walks through the doors really loves the programs and sees how valuable it is to them. And many of our caregivers are still working, so rely on these programs to make sure that their loved one is cared for throughout the day. The volunteer caregiver program is just what it says. It's agencies that coordinate and train and host hundreds of volunteers to provide socialization, errand running, a friendly visitor service, light housekeeping, and sometimes transportation. It just really depends on what that agency has available, what the volunteers are able to provide, and what that individual needs. And that's something that's fairly unique to our AAA. Legal services can provide some limited legal assistance to older adults and caregivers in some cases. You know, it's not a heavy duty, you know, private lawyer, but they can certainly help with things I think Ryan mentioned earlier, probate issues, you know, estate issues, things like that. And I've listed who the agencies are that are currently funded to provide those services. Now, with our request for proposal process going out now, that new cycle will start in October, so potentially some of these could change. But many of these agencies have been providing all of these different services for many years. Our chore services include things like lawn cutting or snow removal, in some cases some gutter cleaning or minor home repair, but the majority of the funding does go to lawn cutting and snow removal. And then the home injury control is really home safety devices, things like grab bars and shower chairs to really prevent falls for older adults in their home. And they're also provided by the same agencies that provide the home injury control services. We do have a limited amount of funding for elder abuse prevention, and this really goes to primarily community education and professional training and development around elder abuse, really focused on prevention and detection. Some local task forces that exist in our communities. A few years ago, they worked together to develop the No Excuse for Elder Abuse campaign. Hopefully that's something you've heard of, but it's really just an initiative to get the word out statewide about making sure people are aware of elder abuse and exploitation and are able to report it. We also have a small grandparents raising grandchildren program. This right now is only in Oakland and Washtenaw counties. So those acronyms there at the bottom of your screen are the Oakland Livingston Human Service Agency and Catholic Social Services of Washtenaw County. With these agencies are primarily providing support and assistance to people raising their grandchildren. Hearing assistance is provided region-wide by the Deaf and Hearing Impaired Services Organization. This is education and training, just assistance with daily living and quality of life to people who are hearing impaired or deaf. And then the long-term care ombudsman is provided also region-wide by Lakeshore Legal Aid, again currently, and they really are advocates for people in nursing homes and sometimes other licensed settings, and really just working on being their advocate, investigating complaints, and particularly for those who live in those nursing homes or facilities and don't necessarily have family or loved ones that are kind of watching, taking care of them as well. Resource advocacy is also a service that's fairly unique to our region. I'm not aware of anyone else that calls it this, however, anyway. But these are local service providers that have staff that are kind of the boots on the ground out in the community trying to find those isolated seniors, those who are the most vulnerable, helping them with things such as getting access to their benefits, especially their Medicare and Medicaid, working with them on utility assistance. They also work very closely with us and our community living program to refer appropriate people into that program as well. And there are, I think, currently 12 different organizations providing this service. Back about 4 or 5 years ago, we started funding evidence-based disease prevention programs, and this was a federal initiative that provided all area agencies on aging with a dedicated funding stream to health and wellness programs that are evidence-based for older adults and caregivers. So this has really taken off. We have hundreds of these programs going on this year in our region. The most well-known is probably PATH, which is really a chronic disease management program, and there are specific versions of this program for both people with diabetes or people with chronic pain. We have a fall prevention program called Matter of Balance. We have a healthy eating program and several other different programs provided through our local partners. So this is one service that we provide directly ourselves, and we have contracts with local service agencies to provide. So you can call our 800 number or go on our website if you're interested in any of these programs specifically. So there is a lot of other programs and services and initiatives that we do. So I want to mention a few of these, but it's certainly not exhaustive. And we, on a probably monthly basis, tend to come up with new ideas or new ways of doing things or new programs. We're constantly looking for feedback and looking at just ways to make things more effective and efficient so we can deliver more services to older adults, which is our ultimate goal. So one of our other programs is the MAP program, the Medicare Medicaid Assistance Program. This has its own funding source through the Centers for Medicare and Medicaid Services, so it is a little bit different than some of our other programs. Staff and mostly volunteers that are very well trained to answer questions and provide assistance to people on their Medicare and long-term Medicaid benefits. There's no fee for this program. There is one statewide number, but they route you to your local MAP provider. And all of our resource advocates are trained on this as well, so they can also provide information and assistance to people seeking advice on their MAP benefits. It's really important during open enrollment time and as people are looking at their Medicare Part D plans in the fall. MyRide2 is a fairly new service, within the past few years. It's a mobility management service, so it's not a transportation service, it's a mobility management service, and that's an important distinction. MyRide2, we say, is kind of like a concierge or a travel agent for someone who's basically trying to figure out how to get from point A to point B. And that may be within their city, within their county, or within their region. They're trying to navigate the public transportation system, which can be complex, or trying to navigate all the different private pay options or volunteer services. We have a database where we can help people figure out what their options are, and we'll tell them how to get from point A to point B to point C, and what are the different prices that are available, and help connect them to the right or the appropriate services. So we're not providing the transportation service directly, but we are helping people understand the system and how to access it and giving them different options. Same Address is a new social enterprise initiative that we launched within this past year. It is a service that is for private pay. It's not necessarily targeted at the traditional 1B participants. We're really trying to reach people who may have some means to pay privately for services. It is a one-source solution, so they can call and basically say I need X, Y, and Z, and Same Address will help them figure it out, what it is that they need. And the goal here is to generate some additional revenue to help support our traditional programs that are government funding reliant. And so the private pay market will help to generate revenue to support programs for people who really don't have the means to pay for things privately. We also have a website we developed a few years ago called MichiganHomeCareGuide.com. We developed this in partnership with some of our participants in our programs who said, it's really difficult when I need home care to know where to go because there are so many different home care agencies, and it's hard to know which ones are really, providing the best services and providing the best care. So this is kind of like an Angie's List, if you will, for home care agencies where you can go on and look for what are the best, programs you can rate, agencies. You can rate and review them if you've used any of these agencies, or read reviews by people who have utilized them. So just going to list a few more programs on your screen here. I'm not going to go into a lot of detail, but just wanted to let you know that some of these other initiatives and programs are happening. The Aging Matters is our professional training program. We offer quite a few programs throughout the year that's all notified to people working in the field electronically, so you can shoot us an email if you're not receiving those emails so that you know about these trainings. We are working on a couple of different LGBT-related initiatives, so lesbian, gay, bisexual, and transgender older adults, and looking at education and training and awareness for that population. We participate in a variety of caregiver fairs throughout our region, but we also host our own, which is a fairly large event that usually occurs in October of every year and rotates between Macomb and Oakland counties. We sit on all kinds of different groups and coalitions and just local planning groups. So there's a lot of those going on, especially in the area of elder abuse or just general human service work. And then just going to let you read on your screen some of these other programs, but I'm going to give you both Ryan and I's email at the end of this. So if there's anything specifically you have more questions on, or any questions on, you can shoot us an email at any time. Encourage you to check out the PACE program if you're not familiar with that program. That's in Ypsilanti and serving people in about a 30-mile radius for that program, where they come every day or most days and spend their days, and they get all of their care and service needs met at this center, including socialization and meals, but also access to medical care. These are people who are otherwise nursing home eligible, in most cases, Medicaid eligible, and are seeking most of their services at this center. Here is a list of, here's our website, as well as a list of some other resources or places to go if you're looking for valid and reliable information. And then finally, you have both the email for myself, Andrea Mulheisen, or Ryan Cowmeadow, if you have program or questions specifically about the Resource Center or the community living programs, you can contact Ryan. So we hope that you found this information helpful, and hopefully you can have a better understanding now of how to access our agency and our programs. So we hope you have a great day.